A curved or phased array transducer with an obstetric exam type is used to perform a transabdominal examination to evaluate an ectopic pregnancy. It is helpful for the patients to have a full bladder to complete this examination. The transducer is placed in a longitudinal orientation in the midline at the level of the symphysis pubis. The orientation marker is directed toward the patient's head. The transducer is placed above the pubic symphysis and angled into the pelvis to visualize the bladder, which appears as an anechoic triangular structure. The uterus is echogenic or gray in appearance and can be seen directly posterior to the bladder. The endometrial stripe will appear as a bright, echogenic line from the uterine fundus to the cervix. Posterior to the uterus is the rectouterine pouch, which should be evaluated for free fluid. The transducer should be swept from side to see the entire uterus. The transducer is then placed in a transverse orientation in the midline at the level of the symphysis pubis. The orientation marker is directed toward the patient's right. The transducer is placed above the pubic symphysis and angled into the pelvis to visualize the bladder. The uterus can be seen as an echogenic circular structure directly posterior to the bladder. The endometrium will appear as a hyperechoic horizontal line. The transducer should be swept superiorly to inferiorly to see the entire uterus. In a patient with a suspected ectopic pregnancy, the presence of an intrauterine pregnancy makes the diagnosis unlikely. The earliest sign of pregnancy seen by ultrasound is the gestational sac. However, a decidual cyst or pseudogestational sac, which can be seen in an ectopic pregnancy, may be confused for a gestational sac. Therefore, definitive sonographic evidence of an intrauterine pregnancy should only be established when a gestational sac containing a yolk sac is identified in two planes within the endometrium. A gestational sac can be seen within the uterine cavity by about 6 weeks gestational age using transabdominal ultrasound. The gestational sac appears as an anechoic, fluid-filled circular structure surrounded by two hypoechoic rings within the mid-portion of the uterus. The yolk sac can be seen by 6.5 weeks and appears as a small, bright hyperechoic ring within the gestational sac. A fetal pole or fetus can be seen attached to the yolk sac by 7 weeks, and fetal cardiac motion should be seen after 7 weeks. If no evidence of an intrauterine pregnancy can be seen, the adnexal structures can be evaluated for signs of an ectopic pregnancy. The transducer should be slowly swept to the lateral aspects of the pelvis. The ovaries appear as round or oval-shaped hypoechoic structures and are often located anterior to the iliac vessels. Follicles may appear as multiple hypoechoic cystic structures within the ovaries. Some follicles may be quite prominent, depending on the luteal stage. After ovulation, a ruptured follicle may develop into a corpus luteum cyst, which will appear as a large anechoic round structure within the ovary and may persist for up to 3 months. An ectopic pregnancy will appear as a complex echogenic structure and may contain identifiable embryonic structures, including a gestational sac or fetus. Doppler ultrasound may demonstrate a hypervascular ring of fire sign associated with ectopic pregnancy. Documentation of fetal heart activity in an extrauterine location confirms the diagnosis of an ectopic pregnancy. The adnexal structures should be evaluated bilaterally for evidence of pathology. In patients with a ruptured ectopic pregnancy, free fluid will appear as a hypoechoic or anechoic collection posterior to the uterus. If fluid is seen in the pelvis, a view of Morrison's pouch should be obtained. The probe is moved to the right upper quadrant in the mid-axillary line with the marker facing the patient's head. Hemoperitoneum can be seen as a dark, hypoechoic stripe between the liver and kidney.